Hello, our dear viewers. Welcome to today's episode of Afya Health and Lifestyle interview series. On today's episode, we'll be talking to Dr. Jumoke on fibroid, the importance of fibroid, the predisposed people, and how to manage this very common disease amongst women. Before I bring up Dr. Jumoke, I would like us to get to know her better.
Dr. Olajumoke Ogunro is an obstetrician and gynecologist. She had both her undergraduate and postgraduate training at the Lagos University Teaching Hospital, LUTH, Idiaraba, Lagos, Nigeria. She had served as a consultant in obstetric, gynecological, and reproductive health matters to both public and private health institutions before joining the team at the Alpha Assisted Reproductive Clinic, Ikoyi, Lagos. During this fruitful decade of service, she had helped many families experience the joy of childbearing and motherhood. Her irrepressible passion to improve the overall health of women through education and information dissemination led to the establishment of Fertility Health Facts, an online evidence-based blog. She is also the author of 9 Months and Beyond, a book that provides essential information about pregnancy, delivery, post-delivery, and newborn care. Dr. J is a devoted humanitarian and philanthropist who had sown a great deal of her time and financial resources into various charity projects, including Ask the Pediatrician. She is happily married and blessed with children.
Hi, welcome to Afya Health and Lifestyle interview series, Dr. Olajumoke. We are very, very excited and happy to have you in our midst.
Thank you very much. Thank you for having me.
All right, ma. Without wasting time, I want us to go straight into the topic. And the topic for today is, of course, fibroid. And fibroid is very common. And when I mean very common, we see it around us every now and then. So this is a very good opportunity for people to understand what it really is, what they should do at every point in time, and how to prevent it if there is any. So, Ma, for our viewers' sake, what exactly is fibroid?
Okay, so fibroids are benign growth of the muscle of the womb. Okay, so basically, when we say benign, we mean that it is not cancerous. It is a growth, but it is not a dangerous. It is not cancer. All right, and it starts from the muscle of the womb. The womb, of course, we know is where babies are carried in the mother, and sometimes when they grow within the muscle, they can now extend and grow outside or grow into the cavity. I believe we'll get to that later.
All right. Thank you very much for that brief explanation. So, from the explanation, we can easily tell that it's most likely going to happen in only women, right? And if it happens in only women, what exactly causes it?
All right, so the cause of fibroid is not known typically to say, okay, this for sure is what causes fibroids. But what we know is that there are some people that are predisposed to having fibroids, that they have a higher risk of having fibroids. All right, so people like, for instance, people of the African race. Africans are more likely to have fibroids than the Caucasians, that's the whites. Okay, we also know that for women that have not been before, they are likely to have fibroids. Also,
Dr. Olajumoke, from your definition, we can tell that fibroid would only be happening to women. And looking at that, what can you say is the cause of fibroid?
okay, yes, definitely fibroids affect only women. Those are the ones that have the womb. Okay, so basically we don't have a cause for fibroids, of course, but for now. But what we know is that there are certain people that risk of having fibroids. All right, so people that are within the reproductive age group, meaning women between the ages of 15 to 49 at risk of having fibroids. We also know fibroids than the whites. Also, obese women, that means women that are overweight are also prone to having fibroids. People that have had, women that have small families or they've not had a live baby, they've not had any delivery before, are also prone to have fibroids. But we do not know the cause of fibroids. We know that basically fibroids, the female hormones that are being produced, the fibroids. And that is why usually tend to get bigger in where you have this level in the fibroids are also known to shrink and become smaller when the woman is menopausal and the female hormones, estrogen and progesterone, the levels are quite low when a woman is menopausal. So we know that those factors aid the growth of fibroids. We also know that there is a genetic predisposition to fibroids. Women that have fibroids, sometimes their mom or their siblings, their sisters, may also have a history of fibroids. These are some of the risk factors we know about fibroids, what makes certain people prone to fibroids.
All right. All right. Thank you, Ma. Thank you, Ma. So you've told us now that the black race is more prone to having fibroid. Maybe that explains why it is very common around us, why we see it every now and then. But then, for a lot of people out there, probably that are not in the medical line and all, how can we identify when we see these things on our mothers, our sisters, our friends, our neighbors? How can we easily identify that, oh, okay, this is fibroid?
All right, so the truth of the matter is that sometimes you are not able to identify a woman that has fibroids just by looking at her. All right, because the truth of the matter is like I said, the fibroid is a growth. The fibroid may be so small that the woman does not even know she has fibroids. Okay, so she may not know she has fibroids. She may just go for a scan for something else. Maybe she's pregnant, she goes for scan, or she goes to assess herself for something else, and then she shows that she may have fibroids. So she goes for a scan for something else, and they discover she has fibroids. So it doesn't mean that not all fibroids come problem. All right. Sometimes, so some fibroids may not give any problem, and the woman does not know, even if she dies, she has fibroids. But if she's, for instance, somebody that goes for routine medical checks, it may be picked up from her during a routine medical check. However, there are certain complaints a person with fibroids may have that may suggest she has fibroids. For instance, a woman notices that her period has become prolonged and it has become heavier. Meaning, for instance, say prolonged, may have been normally her period, she menstruates for about 4 to 5 days, but she now notices that she menstruates beyond 8 days, 9 days, 10 days, or sometimes 11 days, which suggests that she may have fibroids, meaning her menstrual flow has increased, the duration of her menstrual flow has increased. Perhaps her menstrual flow may become heavier, meaning, for instance, she may use a pack of sanitary towel or two for the whole period, and she now notices that this period is very, very heavy. In fact, I'm having a lot of bleeding is going on, and I'm having clots associated with my periods. That's such that my sanitary pad now I use 4 parts during the menstrual cycle. That could be a pointer to the fact that she has fibroids. Remember, I said pointer. It doesn't necessarily, because there are other things that cause this. But one of the commonest causes of periods becoming very heavy, becoming prolonged, are fibroids. Also, a woman may notice that her tummy is getting bigger. She's not necessarily getting fatter overall, as in she has not added weight per se, but she notices that my tummy is getting bigger. It's not as if I've added weight. I just noticed that it's this part. It seems as if it's getting bigger, and I'm not pregnant. That's may we have to go for a medical checkup, to have a scan done, and there a diagnosis of fibroids can be made. Sometimes, depending, so if the fibroid, for instance, is pressing on other structures within the abdomen, then it may be some form of concern for her. For instance, she may if it is sitting on where the passing urine more frequently, and that may lead her or cause her to seek medical help. So these are some of the ways to identify when also sometimes the period may all of a sudden become more painful. She notices that before I just have mild menstrual pain, what we call dysmenorrhea. All of a sudden the periods become very heavy and they become more painful. This may also push her to seek medical advice and maybe on routine examination, depending on the size of the fibroid or from scan, ultrasound scan, they may identify a fibroid. So sometimes just by looking at a woman, it's hard to tell she has fibroids, but these are some of the things that a woman may complain about that may suggest she may have fibroids.
All right. Thank you very much, Ma. Um, Looking at all you've said so far, um, you mentioned that the causes are not known. Um, what advice are you going to give women? Because I'm very sure there's a lot of wrong information out there concerning the causes of fibroid. In fact, the most common one is that it is spiritual. Some will even say, oh, it's a child that is dead that now became that, all of that. So, what advice do you have for women out there so that they can be more informed and know what steps to take when they find themselves in this position?
So thank you for that question. Well, what's the advice I have for women? Basically, number one is that fibroid is not as dangerous in quotes as people think it is. All right, fibroids, like I said, they are benign growth. It is not cancerous. Two, fibroids are relatively common, quite common in women, especially in this our environment. Three, that not all fibroids require treatment. What chases women away or puts young people is the fact that once they hear fibroids, they think, they want to cut me open, they want to do surgery. Sometimes women have fibroids. If it is not disturbing you, we do not go after it. If you're having complaints, for instance, a woman comes, she's not having any complaints, and you see a fibroid that is just like 1 centimeter or 2 centimeters, not disturbing her lifestyle in any way, no doctor is going to go and open you up for that. So the take home is that not all fibroids require treatment. Medically, we only treat fibroids that affect your lifestyle, that give you symptoms, that give you complaints, such like you are bleeding excessively and you are bleeding such that the bleeding is so severe and it's making your blood level to it reduces your blood level, okay, and which reduces your blood level. When your blood level is low, we say you have anemia. So when the bleeding is so severe that it causes anemia, then it's something worth treating. So take home is that not all fibroids require treatment. So if disturbing you in any way, what we do is to watch. Now, not all fibroid treatments end up in opening you up these days. All right, there are so many ways of treating fibroids. Okay, so many ways of treating fibroids. What we look at is number one, your age, number two, the fibroid, number three, what's giving you symptoms, whether they are disturbing you, and number four, whether you still want to have children or not. All these put together determine the kind of treatment we give you for fibroids. And it is not every fibroid that you have that you spend days in the hospital. These days, some remove fibroids and you go back home the same day. Okay, and the last final thing is that all this inserting herbs, inserting corrosive agents into your vagina with the aim of shrinking fibroids actually cause more harm than good. Thank you.
Thank you, Dr. Olajumoke. Dear viewers, you've heard that not all fibroid cases would make you end up on the surgical bed, uh, depending on how you are feeling, the symptoms, and all those are things that will determine the treatment you are going to get. And of course, it is not spiritual. Also, you should know that the use of all those traditional herbs and inserting materials into your vagina just to try to shrink it is very, very bad for your health. So the best option is always to seek medical advice from the professionals, because they are the ones that know what exactly to do. They give you your options, and then from there you can move on. So Dr. Olajumoke, I know you said we don't have we don't have a known cause, but are there ways to prevent fibroid? Because of course they say prevention is better than cure. So if there are ways to prevent it, and knowing fully well that it is very common in this part of the world, because we are, of course, it is more common in Black people, what exactly are the advice you would give as regards prevention?
Okay. So one prevention of fibroids, prevention is easier when we have known cause. So with fibroids, it's a little bit difficult to say we can prevent it. Okay. So we cannot prevent it. There's no scientifically proven way or method right now in fibroids. Sometimes people have said that, okay, people that vitamin D excuse are more to fibroid, but these are not evidence-based, they're not scientifically proven. So there is actually no way per se, no way to say, okay, if I do this, I will prevent fibroids from growing. Rather, the most important thing is to identify when you have a fibroid and go for the right treatment option. So prevention, we usually talk prevention, have a known cause. But when when the cause of something is not really known, then we can't really talk about prevention at this point. Fibroid. So what I'm just trying to say in a nutshell is that there is no scientifically proven step or method of preventing fibroids. The only one way of preventing fibroids is to remove the womb. And this is hard because if you've not completed your family or you've not had all your children, removing the womb will not be an option for you. Because of course, if you remove the womb, fibroids grow. So no womb, no fibroid. However, for a young who has not had her children or has not started a family, you cannot give that advice.
All right. Thank you. Thank you very much, ma'am. Do you think that enough awareness is being given on fibroid? Because at the end of the day, knowing that there is no known way of prevention, which means it is all about the treatment and the cure when a woman has fibroid. That means people need to be informed to know what to do when they find themselves in that position. So, do you think enough awareness is being created? Does the woman out there that sells something in the market, does she know about this? Is there avenue of trying to educate them concerning fibroid?
Well, that quite a number of people know about fibroids. I'm talking about really common. We've had some people that have had not pleasant experiences, maybe celebrities or complications of fibroid surgery. So a lot of people know about fibroids. However, what people do not know is that there are different options for treating fibroids. And what people do not know also is that it is not all fibroids that require treatment. And sometimes it is not all fibroids that require surgery. All right. A lot of people do not know that there are different options available for fibroid treatment. So, the average woman, once they say fibroid, the next thing she's thinking of is surgery. Another issue is that sometimes people think that when they have fibroids, it affects fertility. There's so many people too that have fibroids and they've been able to conceive. Okay, so people have to be aware that people have to be aware that there are various treatment options, and what the options they tend to run to usually does more harm than good. Okay, I've seen a patient in the past that she didn't even have fibroids, but she was told by all these other unorthodox people that she had fibroids, and they put a hotspot on her tummy, and they told her to insert certain things, and at the end of the day it caused the closure of her vagina. Okay, and sadly this woman didn't have fibroids at all, and so many people have had complications in that bid to treat fibroids in other ways apart from surgery, not knowing that it's not every fibroid that requires surgery. So people have what I just want to increase the awareness of the various treatment methods of fibroids. Men just have to have it that it's not all fibroids that require surgery.
All right. Thank you very much. Thank you very, very much. Um, Lastly, rounding up, from your wealth of experience and the fact that you've met with a lot of women with this condition and have helped treat and taking care of a lot of them, what advice, as we round up, what advice would you like to give women out there?
Well, it's about the fibroids are very common. Not all fibroids end with surgery. If you notice that your periods have become very heavy, or your periods last for very long days opposed to what it was before, or you notice that your tummy is becoming bigger, seek medical help. Seek medical help. See your doctor. Don't go to any traditionalist giving you other alternatives to the treatment of fibroids. Thank you.
Thank you very much, Dr. Olajumoke, for joining us. Really enjoyed and learned a lot from you. Thank you, ma.
Thank you. Thank you for having me. Well done. Keep up the good work.
All right, dear viewers, thank you for joining us today. Yes, that was Dr. Olajumoke Akindele. She talked extensively on fibroid, and if there is anything to take home is that remember, the causes for fibroid are not known, at least not yet, and also not all fibroids leads to surgery. Putting that at the back of your mind, you know that the best place to go to when you realize that, oh, your menstruation is taking longer than necessary, you're having heavier bleeding during your menstruation, is to go to a well-informed doctor, that is, go to a good medical facility, not the unorthodox household places where they give you things to ingest that now complicate issues. So please, it is important that you take care of yourselves, and that is why we are here, to give the necessary information, to debunk rumors and misinformation, and to make sure that you have the necessary information at the tip of your fingers. Thank you very much for joining us as Afya Health and Lifestyle Interview Series this week, and we look forward to having you on our show next week. Thank you, and God bless you.